Did you know that 45% of deaths in developed countries is produced by fibrosis-induced organ failure? Among those affected are patients with rare genetic diseases, such as Myhre syndrome, produced by SMAD variants, which currently does not have any efficient treatment. I'm Carlos Tourné, postdoctoral researcher in Professor María Macías' laboratory, renowned by its studies on SMAD transition factor and TGF-beta pathway, key drivers of fibrosis and Myhre syndrome, and beyond. Through our project, Drugs for Rare Diseases, we are developing a first-in-class drug candidate designed to slow or halt fibrosis progression by targeting a SMAD protein family. This approach leverages years of cutting-edge research on Myhre syndrome-specific SMAD variants, giving us a unique edge in both disease understanding and therapeutical strategy. Our vision extends beyond rare diseases. We aim to address broader medical challenges like idiopathic pulmonary fibrosis or cardiac fibrosis, which affect millions worldwide. We are eager to collaborate and share more about this transformative project. So if you're interested, let's connect.